Now move on to discuss the internal structure of the heart, including the atrium, the ventricle, and the heart valves. Let's use this image to review the internal anatomy of the heart. Blood is returned to the right atrium through the superior and inferior vena cava. The right atrium and the right ventricle are connected through the atrioventricular valve or the tricuspid valve. Inside the right atrium is the fossa ovalis, and the cusps of the atrioventricular valve are attached to the chordae tendineae and the papillary muscle. Also inside the ventricles are trabeculae carneae. These are muscular folds that decrease friction during pumping. The left and right ventricles are separated by the intraventricular septum. On the left side of the heart, the left atrium and left ventricle are separated by the atrioventricular valve known as the mitral valve. The right atrium. Deoxygenated blood is returned from the head and neck region and the rest of the body through the superior and inferior vena cavas. The coronary arteries collect blood from the heart muscle itself and deliver it to the right atrium through the coronary sinus. The left and right atria are separated by the interatrial septum. The foramen ovale in the right atrium facilitates blood flow directly from the right atrium to the left atrium during lung development in utero, and this closes approximately within 48 hours after the birth of the baby. Deoxygenated blood is pumped from the right atrium through the tricuspid valve into the right ventricle. The right atrioventricular valve is known as a tricuspid valve because it's made up of three cusps. The trabeculae carneae are muscular folds on the inside of the ventricle. They're believed to prevent suction during pumping action of the heart that would occur with a smooth inner surface. The pulmonary valve is located on the superior medial portion of the right ventricle. This valve is made up of three semilunar cusps, and blood passes through it into the pulmonary trunk. After gas exchange in the lungs, blood returns to the left atrium. The left atrium receives oxygenated blood from the lungs through the pulmonary veins. There are two on the left side and two on the right. The muscle wall of the left atrium receives its blood supply from the left circumflex coronary artery. In an individual in which the foramen ovale failed to close at birth, this is known as an atrial septal defect. The shunting of blood across this defect leads to a mixing of arterial and venous blood. The internal anatomy of the left ventricle. The left ventricle is the most powerful pumping chamber of the heart. Its muscular wall is the thickest, approximately 1.1 centimeters versus 0.5 centimeters for the right ventricle. The left ventricle is responsible for pumping the blood throughout the systemic circuit, as opposed to the right ventricle, which pumps blood to the lungs. The blood enters the left ventricle from the left atrium through the left atrioventricular valve known as the mitral valve. At the end of systole, when the ventricles contract, blood exits the left ventricle through the aortic valve into the ascending aorta and on to the rest of the body. The interior surface of the left ventricle has more prominent trabeculae carneae and two large papillary muscles attached to the bicuspid mitral valve. The heart valves. The heart valves on the right side are the atrioventricular valve or tricuspid valve. The atrioventricular valve on the left side is a bicuspid valve. The two semilunar valves of the heart are the aortic valve, which separates the heart from the arch of the aorta, and the pulmonary valve, which separates the heart from the pulmonary trunk. The heart valves separate the atria from the ventricles and the arteries and veins connected to the heart, such as the pulmonary artery and the pulmonary veins. The heart valves can be opened for filling, and they're open due to pressure in the ventricle. These valves found between the atria and ventricles are known as atrioventricular valves or AV valves. The AV valve on the right is a tricuspid valve, and it has three flaps. The AV valve on the left is a bicuspid valve, and it has two flaps. The two atrioventricular valves of the heart have unique attachments. Attached to the cusp are chordae tendineae, and those are attached to papillary muscles. The cusps of the heart valve open during the cardiac cycle to permit blood flow past them into the ventricles. The cusp itself is attached to the wall of the heart through the chordae tendineae and the attached papillary muscle. The tension of the papillary muscle keeps the cusp of the heart valve from inverting and prevents the regurgitation of blood. For example, tension on the cusp of the AV valve prevents the regurgitation of blood into the atria when the ventricles contract. Let's look at the action of the valves during systole and diastole. When the ventricles are relaxed, the right atrioventricular valve and the left atrioventricular valve are open. These allow filling of the ventricles with blood. During this phase of the heart cycle, the semilunar valves are closed, preventing blood from entering the aorta and the pulmonary trunk. The semilunar valves, aortic and pulmonary, are not attached to chordae tendineae. Instead, the three cusps support each other when closed. Ventricular contraction or systole. During ventricular contraction, the atrioventricular valves are swung closed by the blood moving back to the atria. As blood is pumped out of the ventricles, the semilunar valves are now open. This allows blood from the right ventricle to enter the pulmonary trunk and blood from the left ventricle to enter the arch of the aorta and move on towards the rest of the body. The following is a clinical note on mitral valve prolapse. Mitral valve prolapse is a form of heart disease that's characterized by the movement of an abnormally thickened or enlarged valve cusp that's displaced into the left atrium. The displacement occurs when the ventricles are contracting during systole, and the mitral valve is normally closed. This form of heart disease can range from mild or non-classic to severe or classic. The diagnosis is based on the results of a physical exam and through echocardiography. The swirling and regurgitation caused by an incompletely closed mitral valve creates a heart murmur, and it can be visualized on echocardiography. Most patients with a mild form are followed long-term with no specific treatment. In more severe cases, they require the use of medications to treat chest pain, such as beta blockers, and in some cases, surgery is required to replace the valve. Let's review blood flow through the heart. The blood returning to the heart from the body enters the right atrium through the superior and inferior vena cava. The superior vena cava collects deoxygenated blood from the head and neck region, and the inferior vena cava from the trunk and limbs. These two veins deliver the blood into the right atrium. The right ventricle pumps the blood under low pressure through the pulmonary artery to the lungs for gas exchange. The pulmonary artery transports deoxygenated blood from the right ventricle to the lungs. Next, the pulmonary veins transport oxygen-rich blood from the lungs to the left atrium. The left atrium is a reservoir of oxygenated blood from the lungs. The left ventricle then pumps the oxygenated blood under high pressure to the body. This creates the systemic arterial pressure. The walls of the left ventricle are 3 to 6 times thicker than those of the right ventricle. As the heart beats, pressure is generated within the arterial system and is transmitted to the venous system. Blood flow through arteries is driven by pressure and the elastic recoil of the arteries. The cardiovascular system is composed of a systemic circuit and a pulmonary circuit. Let's discuss these two circuits of blood flow. The pulmonary circuit of blood flow. The flow of blood into the lungs for oxygenation is known as the pulmonary circuit. It's as follows. Deoxygenated blood is returned to the right atrium from the body and is then pumped into the right ventricle through the tricuspid valve. Next, the blood from the right ventricle is pumped through the pulmonary semilunar valve into the lungs via the pulmonary arteries. Within the lungs, the blood releases carbon dioxide, takes up oxygen, and leaves the lungs through the pulmonary veins. The systemic circuit of blood flow. After gas exchange has taken place in the lungs, the blood enters the systemic blood flow circuit. Once it leaves the lungs, the oxygenated blood enters the left atrium and is pumped into the left ventricle. Next, the blood is pumped out of the left ventricle through the aortic valve into the arch of the aorta and the aorta itself. After the oxygenated blood passes through the arch of the aorta, it's distributed to the tissues through the systemic arteries, arterioles, and tissue capillary beds. The blood supply to the myocardium or heart muscle itself is delivered through the coronary blood vessels. The coronary blood vessels are the right coronary artery, which is divided into an atrial branch and a marginal branch, and the left coronary artery, which gives rise to the circumflex branch, the anterior intraventricular branch. The coronary circulation provides the blood supply to the muscle tissue of the heart itself. It's made up of the two main arteries, the right coronary and the left coronary. These two arteries originate at the base of the ascending aorta. The right coronary artery originates at the base of the ascending aorta and then travels down the right side of the heart. This blood vessel supplies the right atrium, as well as portions of the left atrium, the right ventricle, as well as portions of the left ventricle, and portions of the interventricular septum and the conducting system of the heart. The left coronary artery. The left coronary artery originates also at the base of the ascending aorta and gives rise to the circumflex branch and the interventricular branch. The regions of the heart supplied by these blood vessels are the majority of the left ventricle, a small portion of the right ventricle, the majority of the left atrium, and the anterior portion of the interventricular septum. During the contraction of the ventricles, the blood vessels that enter the heart are squeezed and blood flow through them temporarily stops. Also at this time, the blood vessels that do not penetrate the heart muscle and travel on the surface remain open and transport blood. Therefore, the blood perfusion of the heart muscle itself, or myocardium, occurs during ventricular relaxation or diastole. The following is a clinical note on coronary artery disease. Coronary artery disease is also known as atherosclerotic heart disease. This disease involves the accumulation of atheromatous plaques in the coronary arteries. This limits or blocks the normal blood flow through those arteries. The reduced blood flow leads to a decrease in the perfusion of the myocardium, and this results in chest pain and can result in altered heart function. Coronary artery disease is diagnosed based on physical exam, symptoms, and the results of coronary angiography or an angiogram. Coronary artery disease is the #1 cause of death in North America and in most countries around the world. The treatment for coronary artery disease includes the use of medication to lower cholesterol, drugs used to treat angina or chest pain, angioplasty, and in some cases, coronary artery bypass surgery. After the blood supply is utilized by the cardiac muscle, it's returned through the cardiac veins. The blood from the heart muscle itself is drained and returned to the right atrium through the large veins known as the great cardiac vein and the coronary sinus. The coronary sinus delivers the blood into the right atrium just inferior to the opening of the inferior vena cava.